When I walk through these doors, coming here and trying to function as a leader and the glue of the program here is important. Patients walk through the door and make sure that they're seeing every single discipline that they need to see. There has to be collaborative care, meaning that the disciplines are talking to one another, and it has to be compassionate. Being here in the Kimmel Center, we have to be able to wed that care with also good science and good trials. That Kimmel name, it's a high bar, but I think we're up to the task. We'll have to be ever mindful always of that Kimmel name, not only in the care we're providing, but the science and the studies that we're doing here as well. That's a message to the people that I work with. Remember where we're working and what Kimmel is really all about. I'm here in several capacities, one as clinical director for the entire program, but also as medical director for the lung cancer program. And just like I have visions for what the overall program should be, there are certain principles that I want to follow within the lung cancer program here. Central to the program is built on science and the Kimmel science. I think it's important that we are here not only delivering great care, but also offering the best clinical trials for patients and the best novel strategies for patients. I would not be doing my job if I were here just in a clinical capacity. I'm here in a research capacity and to bring that Kimmel name and research and my own research to this program and hopefully can benefit patients in this area. Lung cancer kills more people every year than breast, colon, and prostate combined. Up to 50% of patients now that have lung cancer are either never smokers or former smokers. So this is not necessarily a current smoking disease. When I went into this 10 years ago, there wasn't a lot of strategies other than chemotherapy to treat patients. And here we are. Who would have thought that 10 years later, that lung cancer has really become the poster child for personalized medicine. Finally, with advances in science, and I think Kimmel has been a part of that, we've really made serious strides in beginning to treat some lung cancers, not all, like a chronic disease rather than a cancer. You know, this is a challenging disease. Historically, it's quite aggressive. But we have new therapies approved. These new drugs, of course, immunotherapy, not only extend life for patients, but importantly, provide better quality of life for patients. And that's really meaningful. We are all working under the Hopkins Kimmel name. We are all one system. We are all one team. We're working with the same science and with the same innovative trials that are coming out throughout the system. You wed philanthropy with innovative science and you get the Bloomberg Kimmel Institute. And yes, I wouldn't be doing my job if I weren't interfacing with the BKI to understand what's the next thing that we need to look at in terms of innovative trials or translational science for our patients here at Sibley. I think it's important to talk about the role of immunotherapy, not for all patients, but certainly for a subset of patients. It has elicited incredible responses and outcomes that we haven't seen in a long, long time. I'm hopeful that it remains negative.
Okay.
Yes. I'm very hopeful. But I want to kind of show you. My job as your physician is to be your advocate. My job as your advocate is to balance out optimism and realism. And I've been a lot more optimistic recently than I have in years past. I try to make all my patients aware of A, the research that's going on throughout the country, B, the research that I'm doing, and C, the available clinical trials that they may be eligible for. And I think that in itself instills hope for patients. There is fascinating science here and some wonderful physicians that are Hopkins trained or Hopkins employed. Patients have a choice in this area with very good cancer care that weds, great clinical care with innovative science.